In Kaduna, Governor Sani has pledged to donate 50% of his salary to a special trust fund for the benefit of the poor, undeserved and vulnerable people in the society. This commitment was made during the swearing-in ceremony of 14 commissioners for his new cabinet. Our correspondent Lupe Asan reports.
The governor of Kaduna State, Senator Sani, administers the oath of office to 14 newly appointed commissioners.
So help me God.
Shortly after he announces their portfolios, these nominees successfully underwent the needed screening, paving way for their official induction into public service.
As honorable commissioners, our citizens rightly expect a lot from you. Excuses for lackluster performance will not be accepted. We must put personal friendship aside.
The governor acknowledges the challenging times faced by the country, particularly in the areas of the economy and security. He has pledged to donate 50% of his salary to a trust fund for the poor, underserved and vulnerable in the state. The move aims to reduce the cost of governance and rebuild the lives of those in need as part of his sustained agenda.
I will donate 50% of my salary to the trust fund for the next year. I will continue to use the old cars inherited from the previous administration in Kaduna State. All commissioners must also use the old cars.
Governor Sani also announces the commencement of a statewide immunization campaign in Kaduna. The campaign will administer the integrated fractional inactivated poliovirus vaccine and the novel oral polio vaccine to children between 6 weeks and 59 months old in a phased approach across targeted local government areas.
We are fully prepared to have a quality FIPV campaign that will surpass the last campaign conducted in 2014.
The governor proceeds to officially open a new retail outlet in Kaduna, signifying the state's effort to revitalize the economy through partnership with the private sector. Lupe Asom, TVC News, Kaduna.
The Lagos State Ministry of Health Directorate had organized an event to commemorate this year's World Hepatitis Day. The event is aimed at creating awareness of hepatitis and demystify the misconceptions about the virus. Zainab Akode has more in this report.
Viral hepatitis is a silent killer that claims lives every year, with symptoms appearing once the disease is advanced. According to the World Health Organization, over 350 million people in the world are living with viral hepatitis, which can be identified as A, B, C, D, or E. And in Nigeria, more than 20 million people are living with hepatitis B, C, or both. But more than 80% of the population do not know their status. In addressing this societal menace, the Lagos State Ministry of Health organized a symposium with medical experts, stakeholders, students, and the public to sensitize more people about the disease.
Today is a reminder of the urgency to end hepatitis as a public health menace, especially through increased awareness.
Hepatitis is not a death sentence, just like HIV. There are people that have a positive living with viral HIV. It's in the same way that we are promoting that. Yes, as individuals, ensure you know your status.
The theme of the event, One Life, One Liver, emphasizes on the importance of the liver as one of the most important organs in the body.
Every blessed day, the liver does a lot of functions, over 500 functions. So if we load the liver with things that are not healthy, it can actually result in inflammation, hepatitis, and if not treated, can result into hepatocellular carcinoma.
Experts reeled out some of the misconceptions about hepatitis and some healthy lifestyle tips to protect the liver from damage.
Nigerians should cut down on alcohol intake. People should also make sure they are not overweight, because if you're overweight and you have fat in your liver, that becomes a double problem for you.
With quality health care and a safe environment being one of the priorities of Governor Babajide Sanwo-Olu's administration, this is just one way to ensure a state free of hepatitis by year 2030. Zainab Akonde, TVC News, Lagos.
One Life, One Liver is the theme of this year's World Hepatitis Day, which seeks to emphasize the link between viral hepatitis infection and liver inflammation. injury and damage, and the broader issues of liver health and primary health care. Experts at a one-day free screening, testing and vaccination insist on more vaccination. Health correspondent Kemi Balogun has more in this report.
Hepatitis causes the breakdown of the liver's normal structure, which prevents the liver from working correctly. More than 91 million Africans are living with hepatitis. In 2019, an estimated 1.2 million new hepatitis infections and 125,000 hepatitis-related deaths occurred in the African region. Hepatitis deaths occur mostly among the young and productive segments of the population. This happens despite the availability of vaccines. This community is getting a sneak peek into how hepatitis can affect people and how they can test and treat it before it becomes life-threatening.
We want to sensitize the people that hepatitis is real. It's a silent killer. So they need to be aware that there is something called hepatitis. So we are here today to carry out tests on hepatitis B, hepatitis C, and HIV.
For those who are free of hepatitis, they can get vaccinated. And of course, you know the schedule of vaccination, which is 3 doses of hepatitis B. So today we are going to be giving some of them the first dose. Those who have taken before perhaps will get a second dose.
The World Health Organization says despite the availability of diagnostic tools and effective treatment, more than 90% of people living with hepatitis in Africa do not receive the care they need.
It is important that communities are empowered to confront this challenge head-on by prioritizing prevention, education, and public awareness, which are key weapons in the fight against viral hepatitis.
Do we have it in our minimum service package? If not, I believe it's time to do it. The highest burden of hepatitis B infection in children below 5 years of age is seen in countries without hepatitis B vaccination at birth.
Experts believe that testing and treatment as a public health approach remains the most neglected aspect of the response. Kemi Balogun, TVC News, Abuja.